All right, welcome. Today, we're going to unravel one of the most complex topics in medicine, but not like a dry textbook. We're going to tell it as a story. It's this incredible microscopic drama about how just one single cell in your body can decide to break all the rules and become cancer.
So that's the big question, right? How on earth does something so tiny, something you can't even see, turn into something so incredibly formidable? Well, to get the answer, we have to go deep inside the body, to a world that normally runs with absolute beautiful precision.
Okay, let's dive right in. I want you to picture your body as this huge, perfectly organized society with trillions of cells. And every single one of them has a job to do, a schedule to keep, and a strict set of rules it has to follow. It's a really beautiful natural order.
So a normal, healthy cell's life, it's like a simple three-act play. Act 1, it lives and does its job. You know, being a skin cell protecting you or a liver cell detoxifying things. Act 2, when the body needs reinforcements, it divides, making a perfect copy of itself. And Act 3, when it gets old or takes some damage, it hits the self-destruct button in a process called apoptosis. Live, divide, die. It's this clean, controlled cycle that's absolutely essential for keeping us healthy.
But what happens when that perfect system breaks? This is where our story really takes a turn. The conflict starts the very moment a cell begins to ignore those rules, and it almost always happens because of tiny glitches in its genetic code.
To really get what goes wrong, just think about a cell's DNA like the control panel in a car. You've got your proto-oncogenes, that's the gas pedal, telling the cell, go, time to divide. Then you have tumor suppressor genes. Those are the brakes shouting, stop. You've also got DNA repair genes, kind of like your personal mechanic, ready to fix any little problems that pop up. And finally, apoptosis genes. That's the big red eject button for when things are just beyond repair.
So a mutation is really just a glitch that messes up that control panel. Suddenly the gas pedal is jammed to the floor, or the brakes are cut, or the mechanic fell asleep on the job, or that eject button is just plain broken. When any of these systems fail, that one cell can just start dividing and dividing, completely out of control.
So what causes these glitches to happen in the first place? Well, the triggers are often things we call carcinogens, and they kind of come in three main flavors. You have chemical ones, like the stuff in tobacco smoke. You have physical ones, like the powerful UV radiation from too much sun. And you even have biological ones, like certain viruses or bacteria. H. pylori, for instance, is famously linked to stomach cancer.
Now, when one of these rogue cells divides again and again and again, it forms a lump or a mass that we call a tumor. But, and this is so important, not all tumors are created equal. This is a really vital distinction to get.
You can almost think of tumors as having two totally different personalities. On one hand, you've got the benign tumor. One of our sources had a great analogy for it, calling it gentlemanly. It's polite, it stays in one place, it doesn't spread. Generally, it's not cancerous. But on the other hand, you have the malignant tumor, which was described as cursed. This one is an invader. It breaks through boundaries and has the dangerous power to spread. This is cancer.
And that scary ability to spread has a name, metastasis. It is the defining, most dangerous feature of a malignant cancer. This is where rogue cells break off from the main tumor, jump into the bloodstream or the lymphatic system like it's a superhighway, and start setting up new colonies, new tumors, in totally different parts of the body.
Okay, so because cancer has this ability to spread, doctors obviously need a way to figure out exactly how far it's gone. This process is called staging. You can think of it like they're creating a map of the disease, which is crucial for figuring out the best plan of attack.
The most common way they do this is with something called the TNM system, and it's actually wonderfully simple. It just answers three basic questions. T is for tumor. How big is the original one? N is for nodes. Has it managed to spread to any nearby lymph nodes? And M is for metastasis. Has it traveled to distant parts of the body?
The answers to those T, N, and M questions then give you a stage, usually from 1 to 4. So stage 1 basically means the cancer is small and it's still in one place. Stages 2 and 3 generally mean it's gotten bigger or has started to spread into the neighborhood, nearby tissues or lymph nodes. And stage 4,
Well, that means the cancer is metastasized. It's on that superhighway, traveling to distant organs. Okay, so that's the general story of how cancer works. But to really see how all these things, the genes, the tumors, the stages, all fit together, let's make it real. Let's look at a case study of one of the most common cancers in the world, breast cancer.
Now, here's something that is absolutely critical to understand. Breast cancer is not one disease, not at all. It's really an umbrella term, and the specific type of breast cancer you have is defined by what's fueling its growth. Many types are hormone receptor positive, meaning they feed on hormones like estrogen. Others are HER2 positive, driven by a specific growth protein. And then you have triple negative, which, like its name says, doesn't have any of these common drivers.
So why does that matter so much? Because knowing what's driving the cancer is a total game changer. It allows doctors to use targeted therapies. If the cancer is fueled by hormones, you can use drugs to block those hormones. If it's driven by that HER2 protein, you can use drugs that go right after that protein. It's a much smarter, more precise way to fight, and it has absolutely revolutionized treatment.
And this brings us to one of the most important and maybe most counterintuitive takeaways from all of this. Malignant tumors in their early stages are very often painless, and that's exactly what makes them so dangerous. It's easy to ignore them. The lesson here couldn't be clearer. Early examination is, without a doubt, your most powerful weapon. Don't wait for pain to be your signal.
So we've gone on the entire journey, from a single healthy cell just doing its job, to a rogue cell with a broken control panel, to a complex disease we can now map and target with incredible precision. We've seen that this huge, complex challenge actually starts at the tiniest possible scale. And that leaves us with one final, and I think empowering question. Knowing that this whole story starts with just one cell, what is one simple step you can take for your health, starting today?